Hey folks, welcome to Dr. Maya's Straight from Gut channel. Today's discussion will be about pancreas, specifically pancreatic cancer, why the outcome is so poor and why it is not diagnosed until it's too late and why it causes minimum to no symptom at all. As a result, the prognosis is poor. To understand the intricacies of pancreas, first let's discuss the anatomy. Pancreas is a retroperitoneal structure, meaning pancreas is more close to the back as opposed to the front of the human being. In fact, if you cut the abdominal wall and open it up, you are not going to see any pancreas. Pancreas is a very deep-seated gland. So if you cut the human stomach, first this is the diaphragm muscle, above which the lungs stay and the heart is resting. Below it is the liver, and then comes the stomach, which covers the pancreas, stomach as well as part of the small intestine. And here lower down, this is the transverse colon, or the transverse part of the colon. So as you can see from the front, we cannot even see pancreas at all. It is a very deep-seated structure. So how do we see pancreas? We have to mobilize all of these organs one by one. So let's first take out the colon and the small intestine, and next we're going to take out the stomach. And now here you can see little bit of the pancreas. Pancreas is the long gland. It has its uncinate process, head, body, and the tail. And as you can see, its head is wrapped around the upper part of the small intestine. Is also even below the liver, is more close to the spine and the big vessels. The tail of the pancreas is attached to the spleen, which is on the left upper side, and on the right side it is encircled by the upper part of the small intestine. In addition to that, note the relationship of different vessels. Aorta, vena cava, these are the major vessels of distributing blood and returning blood to the head, and these are portal vein and arteries that goes to the liver and connected with the liver, in addition to some of the contributions of what you call splenic artery and splenic vein, things that go in the spleen. So as you can see, number one is being very deep-seated. It has a lot of areas to grow before even it puts any mechanical effect on the adjoining organ or inside the belly, because in our belly there is always extra space. And then as pancreatic cancer grows, it can easily invade into the blood vessels in the front or in the back, or even in the spleen, or even in the liver. To make the situation more complicated, the nerve supply of pancreas is different than other parts of the body that we call somatic nervous system. For example, in our skin we have somatic nervous system. So even if a mosquito bites us, even without knowing, we can kill the mosquito. However, in the pancreas and inside the abdomen, we have what we call autonomic nerve supply. As a result of autonomic nerve supply, means it has its own type of nerve supply. The feelings are not as acute and is not well localized. So all of these factors make the diagnosis of pancreas cancer really difficult, and really difficult to know on the part of the patient. As a result, by the time they present to us, to the doctors, most of the pancreatic cancers are still very advanced, and the more advanced a cancer stage is, the more difficult it is to treat. So this explains why treatment of pancreatic cancer is really difficult, as well as, unfortunately, the prognosis or the outcome of pancreatic cancer is so poor still. Now, is there any new development? Not really. I always say there is no revolution in medicine, but there is evolution. Yes, now we have certain technologies, MRI techniques, CT scan technique, that we can probably detect pancreatic cancer a little bit earlier and also more accurately what stage it is. Also, treatment has advanced somewhat. So there is always slow progress every year. However, still we are not anywhere close to satisfaction. I hope this talk explains you a little better about pancreatic cancer and what is pancreatic gland. And again, folks, if you like this talk and if you think this benefits you and helps you in education and understanding the medical issues in a simple way, please subscribe to my channel and like my channel so I can bring more of these talks to you every week. Thank you for watching. Have a great day.